Hello and welcome to the 2024 EUFOREA Global Chronic Rhinosinusitis with Nasal Polyps Awareness Day. Now today we gather once again to shed light on a disease that affects millions of people worldwide, which has recently been termed Nasal Polyp Syndrome. Now, since its inception in 2022, this annual Global Awareness Day has been at the forefront of a crucial mission, and that is to raise awareness about the debilitating nature of chronic rhinosinusitis with nasal polyps, or CRSwNP. But this year, there is a new focus. Over the next 45 minutes, we aim to put the patient front and center. Welcome to the Empowered Patient. Hello, I'm Dr. David Bull, and welcome to the third annual Global Chronic Rhinosinusitis with Nasal Polyps Awareness Day, hosted here in Brussels, in Belgium. Now, chronic rhinosinusitis with nasal polyps, which is also known as CRSwNP or Nasal Polyp Syndrome, is a chronic inflammatory condition affecting the nose and paranasal sinuses. It's estimated to impact about 1 to 4% of the general population and approximately 30% of patients suffering from chronic rhinosinusitis. The symptoms of CRSwNP, both physical and psychological, can be profoundly distressing for patients. Now, these include nasal obstruction, smell dysfunction with anosmia, continuous nasal discharge, facial pain, poor sleep quality, fatigue, anxiety, and depression. Now, as you would expect, these symptoms significantly diminish patients' quality of life. Now, unfortunately, many patients endure unnecessary suffering for years without receiving a proper diagnosis or a referral to a specialist for appropriate treatment. And this then begs the question, well, why does this gap in care persist? And how can we empower all stakeholders, that is, physicians, patients, and policymakers, to openly discuss CRSwNP whilst continuing to advance treatment options for patients worldwide? Well, let's start by talking about the patient experience. And this first section will focus on understanding the broad experiences faced by patients living with the condition. We'll explore the challenges faced by patients, including how they manage their condition on a daily basis and the barriers they face in actively participating in their care. Now, to bring the subject to life and to add real-life experience, we have brought together a plethora of panelists who represent stakeholders across the spectrum of CRSwNP. So first of all, let's welcome our patient representatives. From the United Kingdom, Dr. Catherine Shire. Dr. Shire is a patient. She's also a menopause specialist. She is also a retired general practitioner. From Canada, Jeff Preyra. Jeff is the founder and CEO of 360 Story Lab, which specializes in the creation of augmented reality experiences for entertainment, education, and enterprise. He has had CRSwNP for more than 30 years and is a dedicated patient advocate working in Europe and North America. From the Netherlands, Ulkert Vals. Ulkert is the president of the Patient Association CRSwNP in the Netherlands. And from Spain, we have Victor Gascon Moreno. Victor is Vice President of Awareness and Operations at the Global Allergy and Airways Patient Platform, or GAP. Representing clinicians specialized in nasal polyp syndrome are Professor Witske Fokkens, EUFOREA Innovation Forum Director and Chair of the EUFOREA Chronic Rhinosinusitis Expert Panel. Joining her, Professor Philippe Gevaert. Professor Gevaert is an ENT specialist at the Department of Otorhinolaryngology at the University of Ghent in Belgium, and he's also a member of the EUFOREA Rhinitis Expert Panel. A very warm welcome to all of you. Thank you very much indeed for being here. So let's start, if I may, with the patients, because you're really important in all of this. I really want to understand what it's kind of like to live with CRSwNP on a daily basis. And Ulka, if I can come to you first of all, can you explain what it's like to have CRSwNP, particularly the symptoms that you've been troubled with?
Well, as a child, I always had a lot of congestion. I was always sneezing and my nose was always blocked. Difficult breathing. And about 15 years ago, I lost my sense of smell. So that's quite impactful for my life, not to smell your children, not to smell everything, have a bad taste. Besides that, sleep is a problem because you can't breathe through your nose. So you're tired all the time.
So when you were trying to describe this to your friends, to your family, do they understand how significant those symptoms are? Particularly, I think, the loss of smell. It's something that I think is very underrated, actually.
Yeah, absolutely. You can't get it over that, what the impact is, about impact on your emotions, for example. But also being a bit of tired all the time. It's hard to explain what it is and where it comes from. And then you got a name for a disease which is terrible. So I'm really happy with the new name because it gives a bit more, I hope, awareness and understanding with the people around me.
We'll come on to that a little later, but I'm delighted to hear you like the new name. Let's move on, if we can, to you, Catherine. You're particularly interesting, if I may say, because you're a doctor by training. Obviously, you're a retired general practitioner. And yet, even though you have all this knowledge, your diagnosis came quite late, didn't it? Tell us your story.
Yes, so I was diagnosed 2 years ago, which is when my symptoms became particularly bad and more chronic. But prior to that, I'd had recurrent sinus problems, infections, and a lot of congestion, a lot of rhinitis, which we assumed was allergic, and I did use a spray, but never realized the complexity of it. And since it got worse and I was diagnosed with Nasal Polyp Syndrome, I've also developed chronic asthma, which was new. I didn't have that before, although occasionally I would have a bit of wheezing. And looking back, I've had esophagitis prior to that, which potentially could be related, but nobody recognized that. And even as a child, I did tend to have sinus problems infrequently, but every time I got a cold, I got congested and I had a lot of coughing. So it hasn't been recognized, and I've probably had something there most of my life.
So it's so interesting, isn't it? Once you put the pieces of the puzzle together, in retrospective, with a retrospective view, it all made sense.
Yes, yes, but I didn't recognize that as a doctor, and possibly many of my patients have had similar problems which I didn't recognise.
And I think that is the key to all of this. Of course, GPs, doctors, very used to pattern recognition, but obviously in your case, that pattern wasn't recognised. Let's move on to you, if I can, Victor. You've been recently diagnosed, so you're at the other end of the spectrum in terms of the journey. Listening to your colleagues here, does that have resonance for you?
So in a sense it does. So my journey, as you know, I work with the patient organizations globally, so that means I care for every patient in the world except myself. So I have been living with this condition, I think, for, I would say decades, but I always blame it on living in places with high humidity or allergies, like my mother, right, which is probably also a patient. And I only took care of it when the symptoms were so bad that I couldn't sleep well, I couldn't work well. And especially in COVID, when your nose is like watering all the time, they may, the stigma, like, oh, this person has COVID or has a flu or something. And then you go to the gym and people stay away from you, and then you don't know, like, no, it's nothing, it's allergies, right? So you only take care when the symptoms and the quality of life is so bad that you, like, this is impacting my life.
So when did the penny drop, or how did it transpire that you were then given the diagnosis?
So I remember I was in an event, in a patient advocacy event in Milan, and my nasal polyp was already very big, and I couldn't breathe, and I was watering until my CEO told me, like, you need to take care of this. now because you cannot even work. And I was like, yes, I think it's time for me to go to the doctor.
And then you got your diagnosis. Let's come to you, Jeff, if I may. You've had this condition for over 30 years. You're, I suppose, a very experienced patient. Just listening to the other stories, does that have does that have resonance for you as well?
Oh yeah, David, it's really very, very familiar. You know, a lot of them alluded to kind of the progression, and that was my experience as well. Started off with simple, kind of a runny nose when I was a teenager, but you know, you just kind of take that for granted, and it got worse and worse, and it eventually evolved into chronic sinus congestion, and then eventually, you know, like a lot of people, I lost my sense of smell, and then I developed asthma as a result of that, and that made it difficult to breathe, and that really had an effect on my everyday life to the point where I was unable to work for, you know, briefly for a few days here and there. And it wasn't until it got to that point, like that bad, that my doctor referred me to, and I have an excellent doctor, but he had no idea what was going on. And finally I got a referral, fortunately, to a good ENT who diagnosed me. So
the chronicity got so bad, there was a tipping point where you just thought, I can't deal with this anymore, and that was the gateway to diagnosis. Let's move to you, Oka, if I may, just in terms of treatment. So when you were first diagnosed, I assume they said to you, you need to do first-line therapies. What did they tell you? What was the key to treating you at the beginning?
Well, at first, I wasn't even aware of having the Nasal Polyp Syndrome. So I took a lot of, I thought I had an allergy. So I took a lot of, I went to an allergist, get a lot of tests, get diets, really severe diets. Couldn't eat potatoes, couldn't eat pasta, couldn't eat rice. But it all didn't help, so at the end I go to the ENT surgeon, specialist, and he said, yeah, you got Nasal Polyp Syndrome, at least you got polyps, so we have to treat them and we have to get them out. So I got surgery and they got it out. And it helped. I got my scent back after 10 years, so that was really amazing. But after 3 months, it was over. I couldn't smell again, and I had congestion in my nose, so it helped for 3 months, and then I was back on the point I started.
And for you, I suppose, mentally, that was hugely damaging or challenging for you, because you thought you'd had the surgery, things improved,
yeah,
and then you were back to square one.
Yeah, because you think, if this doesn't help, what would help? And I was under the impression that I could never smell again, because I could smell again if I have another surgery, but you can't have surgery after surgery after surgery.
Indeed. Victor, on your journey, so then you got the diagnosis.
Yeah.
Does this also sound familiar? So they then said, right, first-line therapy, this is what you need to do.
So, well, in my case, so I have experienced 5 healthcares in 5 different countries in 2 continents, and I had the same problem with all of them. That you go to your primary care doctor, which is great, but there is always something else that is more important than what is happening in your nose, right? Like, I have this problem, doctor. Okay, but how is your cholesterol? How is your injury? And you have like 5 minutes, and then at the end it's like, okay, just take antihistaminics to reduce the symptoms and continue your life. So I've been in that antihistaminic, which no effect, just like quick relief, for like 10 years until I got the diagnosis in a proper allergist in Austria. And then they realized part of my nasal wall, part of the wall of the tissue of the wall, it has been gone. It was disappeared because of the damage. And until the point they said, like, you had surgery. And I said, no, I didn't. I never had surgeries. Then there is a piece missing there. It's because I haven't untreated for so long. The damage was very extensive, but I haven't lost the sense of smell or have asthma yet, I guess.
Okay, well, let's hope you don't. Catherine, moving to you. So this was a bit of a shock for you. You got your diagnosis, and then you start on the treatment. Was that the same protocol to say first-line therapies first?
Yes, I'd already been using a nasal spray, a steroid spray, for many years. They obviously introduced the nasal irrigation, but told me I needed surgery fairly quickly. And I had surgery in December, 18 months ago. So, and that did make some difference to my symptoms, but only for a short time.
So not like a card. So in your case, it wasn't quite that revelation. Oh, look, I've had surgery, I'm much, much better. No.
No, it was better for maybe 6 weeks. I could smell a little, but my chest wasn't any better, and in fact that got worse. And then my nasal symptoms returned. It's not as bad as it was initially before the surgery. I don't have the constant headache and pressure now, unless it flares up if I get a cold or something. But I've asked my doctors all along, why is this happening? What's the underlying cause? What can you do about it? And never got an answer.
So that's a brilliant point, because I wanted to come on to that. How much pushback do you get? I mean, you are in an unusual position being a physician, but how much pushback was there for when you went to the doctors and said, look, there has to be an underlying cause, we need to do this, like, this isn't working for me? You saw a lot of pushback, did you?
Yes, it was just kind of dismissed, and they changed the subject. Well, we'll do some blood tests. Blood tests are fine. You just have to see how it goes and keep using the spray.
And Jeff, you're nodding along to that because this obviously sounds familiar.
Well, not, David, not because it's familiar, because it's shocking. The fact that you're a doctor, and because you have so much knowledge already about so many things, that you got that treatment. So you can imagine what would happen to a patient who doesn't have that kind of background and that kind of, say, credibility with the medical care provider.
And what about your own experience, though? Because obviously you have a different system of healthcare where you are. But did you find that they helped you on that journey, or did you have to push?
Well, see, I had a bit of a different experience. As I've said, I've got a terrific doctor, and we have a kind of relationship. We've always had conversations about my, whatever issues that it may be, cholesterol or whatever. So he was very open to these things. And he was like, honestly, I don't know, but here's what the standard of care is for symptoms like this. So we went down that path. But he did not have the kind of background or education or training to say, oh, yeah, this sounds like you might have, something that requires a different kind of treatment.
So that's really interesting as well. So it depends on the physician you see, how much knowledge they have about particular conditions. If I come to you, did you feel you were being treated properly, or did you have to, when you researched stuff, did you go back to the doctors? Did you push back and say, actually, I want something else?
The problem was that when I got the operation and I get the setback of it, COVID came in, so the communication with the hospital was stopped. So there were no appointments, etc. So there was no treatment again.
And obviously it was an extraordinary time across the board in every country, I think.
Yeah, so my problems were minor problems.
And does this, in terms of your story as well, again, you know quite a lot. And were you like fighting with the medical professional, or did you find them on side?
I had to have that conversation with my PC in Austria. I think like I have to sit down with her. I think it's time to take care of this. Because again, she was worried about all the stuff about my health, and I don't blame her. It's obviously important, but I need to have that step with her and say, what is next? How can I get this properly diagnosed and a solution that is not just antihistaminics?
So you had to push.
Yeah, I had to push.
Well, that's a brilliant place to pause that. Thank you very much indeed for the moment. Well, obviously we've heard from the patients. Let's now turn our attention to the clinicians and the healthcare providers. Now, as you would expect, these individuals play a crucial role in guiding patients through their treatment journey, and they facilitate their involvement in managing their condition. Well, today we have the great privilege of hearing from two esteemed clinicians who specialise in the treatment of nasal polyp syndrome.